New Omicron COVID variant is confirmed in more than 20 states tonight. And we know that this is just the latest of several variants that we've tracked since the pandemic started. And that's leading some of you to wonder, how do scientists know if a certain case is Omicron or Delta or another type of COVID? We're verifying your questions tonight.
My name is Gail. I have a question about COVID. I know you like to keep us informed about the COVID numbers and variants. How do I know which variant I have when testing only shows me a positive or negative result?
That's a good question, Gail, and thanks for asking it. To find the answer, we go to the CDC and South Carolina's Public Health Director, Dr. Brandon Traxler. First off, Gail's right. The COVID test you get at the pharmacy or doctor's office won't tell you any details besides positive or negative.
That whole genome sequencing is the only test that would differentiate that whether a person had the Delta variant versus another variant.
Keep in mind, variants of viruses happen when mutations happen. By taking someone's COVID sample and getting down to the genetic level and seeing which mutations the virus has, scientists can determine which variant they're looking at. So the problem is, in the United States, we could see tens of thousands of new COVID cases each day. And we can't look at every single one to see which variant each person has, nor would we even want to.
The goal of surveillance is not to sequence every single positive test. It is to make sure that we are getting a representative sample.
So let's pretend that this turquoise ball is Omicron and this brown one is the Delta variant, and the other colors down here, these are other variants. Rather than looking at each and every one, we would sample maybe some from here, and then some from here, and then see what percentage of this group is Omicron, Delta, and so on. By the way, over its last 4 weeks of data, the CDC got record of nearly 2,300 test samples from North Carolina. Virtually all of them were the Delta variant. That's why we're still able to say the Delta variant is dominant here. So thanks again to Gail for sending that question in. Keep those ideas coming. If you see something online or you just have a question you want our Verify team to look into, one of the ways you can reach us is at verify@wcnc.com.